Question on nursing care plan and nursing diagnosis. Question 1. What is the primary difference between the nursing care plan written in nursing school compared to those written on the job as a professional nurse? The correct answer is B. In the context of nursing process, which type of data is defined by a patient's verbal description of their own health concern? Correct answer is A. Which of the following would be categorized as objective data for a patient admitted with nausea? A heartbeat rate measurement of 101 beats per minute. The patient states they feel queasy. The patient reports having a headache. The patient's family says the patient looks pale. The correct answer is A. The patient's heart rate. According to PES model for nursing diagnosis, what does E stand for? Correct answer is B. When writing the related to factors in a nursing diagnosis, what should the nurse primarily focus on explaining? The correct answer is D. Which phrase should be used at the beginning of every statement in a patient's goal column for a care plan? Answer is A. In nursing school care plan, what must usually follow each nursing intervention to explain the evidence-based reasoning? Correct answer is B. What is the primary action a nurse should take during evaluation phase if a patient's goal was unmet? Correct answer is D. When choosing another diagnosis, what must the nurse check to ensure the diagnosis actually fits the patient's clinical picture? Correct answer is D. Which type of nursing diagnosis is used when a problem does not yet exist, but the patient has factors that make them vulnerable to it? Correct answer is B. In the scenario of a patient receiving chemotherapy and experiencing nausea, what would be the as evidenced by component of the diagnosis? The answer is B. What is the primary focus of the implementation phase of a nursing care plan? The answer is B. Which nursing diagnosis would be most appropriate for a patient with total paralysis on the right side who cannot feed or bathe themselves? Correct answer is A. In a scenario of the stroke patient, why is it important for the nurse to allow the patient to be as independent as possible during intervention? The correct answer is A. What is the purpose of the planning phase in the ADPIE nursing process? Correct answer is C. What does syndrome diagnosis typically represent in a nursing care plan? C. Why does a nursing school care plan help prepare a student for the NCLEX exam? The answer is C. Which discipline other than nursing might contribute to or help revise a care plan in a hospital setting? Correct answer is C. If a patient's blood pressure is 150/90 mercury, millimeter per mercury, and they report a pain level of 7 out of 10, how should this be classified in the assessment? Correct answer is A. When developing a nursing intervention, the statement should start with which phrase to distinguish it from a patient's goal. Correct answer is D. Why is documentation a critical part of the implementation phase? Correct answer is C. A student identified that the patient has readiness to enhance self-care. This is an example of what kind of diagnosis? Correct answer is B. In the case study of a 25 years old chemotherapy patient, her heart rate is at 101 beats per minute, and her temperature is 99.2 degrees Fahrenheit. What might this sign suggest to a nurse? C. What is the very first step in the 6-step plan for creating nursing care plan provided in the teaching? When a goal is described as measurable, what does that mean for the persons evaluating it? The answer is B.